Welcome you all for this e-content sessions. Myself Shashikala Wali, working as Associate Professor, Department of Pharmacy Practice, Scale College of Pharmacy, Kahir, Belagavi. I would like to present a case on steroid dependent nephrotic syndrome with relapse secondary to lower respiratory tract infections. First of all, I am going to explain regarding the SOAP format. According to the SOAP format, I wanted to tell what is mean by subjective evidences, objective evidences, assessment and how planning can be done. So, here what is mean by subjective, mainly focused on the history of the patient. For example, patient's own assessment of conditions, health conditions, chief complaints present and the past medical history and medication history need to be recorded. Followed by what is mean by objective here. Objective components are including vital signs, patient's general appearance, physical finding examinations and the laboratory investigations, and followed by vital signs like blood pressure, pulse rate, temperatures, body temperature, respiration rate, weight, pain, oxygen saturations, patient general appearance, all these informations to be included. Assessment in the sense like we need to collect overall response to the treatment, changes in the patient status, progress toward the goals, justifications and explanation how treatment can be given, and followed by last one, planning, what is the next treatment plan is there, how, when it should be given for the follow-up, what is the educations, patient educations, non-pharmacological, pharmacological therapy, these things can be collected, and discharge medications counseling also can be done in the planning session. What are the learning objectives? By the end of the topic, what are the objectives are going to learn? To understand the demographic details of the patient, to understand the etiology of the case and laboratory investigations of the disease, to provide the pharmaceutical care services to the patients. Here, introductions of the nephrotic syndrome. Nephrotic syndrome is a group of symptoms together show that kidneys are not functioning properly, and what are the symptoms are there? Too much protein in the urine, that is known as the proteinuria, low levels of protein in the blood, that is known as the hypoalbuminemia, and high levels of fat and cholesterol, that is known as the hyperlipidemia, swelling in the legs, feet, ankles or hands, that is known as the inflammations or edema. This is the just we have put the photographs of the functioning of the nephrotic. Patient demographics. Now I will be discussing on the patient demographics. Age of the patients 9 years old, female patients, got admitted around 8 days during the hospitalization stay. The height was 120 centimeter, the weight was 22.4 kg. Coming to the subjective evidence, complaining of fever, cold, cough since 3 days, facial swelling since 3 days, decrease in urine output since 3 days, abdominal distension since 3 days, history of present illness. The grandmother said that the patient was feeling fever, onset and progressive nature, more in the night time, and urine output decreases suddenly and progressive nature, especially in morning time also. There was a abdominal distension is more during the night time. Family history, there is no family history of any relation marriage of the parents. Past history diagnosed with the nephrotic syndrome since 2 years back when child presented with the cold, cough, facial puffiness. History of hospital admissions in 2017 in the month of October, and that time also patient was having the same symptoms, and child was on tablet omnacotil, that is mean by the generic name is prednisolone 10 milligram per day. To BD they have started during admissions also. Later on they have put the one tablet or alternate day for 2 weeks after discharge. They now since 1 month the patient is on 5 milligram of the prednisolone. According to the parents have said that for the child they have given the as per the schedule of the immunizations, and developmental history there is a milestone appropriate for the according to the age. Birth history, the birth weight was 2.8 kg, gestational age was 9 months, and it was a normal delivery, and after delivery patient was cried also. And on examinations these are the reports like it was a hypotension, pulse rate was 88 minutes, and facial puffiness, bilateral pedal edema was seen. And systemic examinations, respiratory system and CVS system, ZNS system was conscious and well oriented. Per abdominal there was abdominal distension and diffuse and dullness, fluid present, and there was no any organomegaly was seen. According to the hematological tests, the HB was good, and the PC was also little bit higher side, and platelet count was little bit higher side, and total WBC was higher side, neutrophil count was higher side, and there was seen mild thrombocytosis with neutrophilic lymphocytopenia. According to the urine test, the patient's urine test was examined, and there the RBCs was nil and WBC was nil, sugar nil, and there was a albumin was present, it was a positive. And according to the diagnosis based on the laboratory investigation, based on the subjective evidences, they did the diagnosis, it was a steroid dependent nephrotic syndrome with relapse of the secondary to lower respiratory tract infections. So what was the planning? Therapeutic goals, the first of all we should reduce the body temperatures and should come to normal level, decrease the cough and cold, reduce the facial swelling and increase the urine output, and reduce the abdominal distensions, and to maintain the hematological parameters up to the normal range. Followed by, based on the subjective and objective evidence, the medications have given for the patients amoxicillin with clavulanic acid 560 milligram for 3 times a day, and for ranitidine 20 milligram BD they have started, and diuretic it was a furosemide 20 milligram because of fluid retentions they have started, and patient was feeling lower respiratory tract infections symptoms, and they started with bronchodilator, that was a salbutamol. Nebulizations they have given, multivitamin with mineral, that is syrup 5 ml they have started BD, and patient was feeling vomiting and nausea, they started with ondansetron 4 milligram, antiemetic they have given, and corticosteroid dexamethasone half cc they have started, and prednisolone 20 milligram they have continued, and followed by like cough syrup containing, that is levosalbutamol with ambroxol plus guaifenesin they have given. Coming to drug-drug interactions, the major dexamethasone plus ondansetron, there is a decrease the effect of ondansetron by affecting the hepatic enzymes. Dexamethasone with the prednisolone decrease the effect of prednisolone by affecting the hepatic enzymes. Minor, we have seen dexamethasone with furosemide, there is a pharmacodynamic synergism, there is a risk of chances of developing the hypokalemia. Prednisolone and furosemide, their same is like risk of the hypokalemia. Discharge medication, they have given that clavulanic acid with amoxicillin, followed by amnacotil 20 milligram for 15 days, and syrup mucolite they have given, and multivitamin syrup they have given, and tablet Shashikala also. Follow up they have called for OPD after 15 days, and they should get the urine analysis report mainly for albumin, and we did the counseling of the patients regarding the medications and regarding the non-pharmacological therapy. Thank you.